Heart rate, or HR, is the number of heartbeats per minute. It is based on the number of heart contractions. In checking HR, you can use the stethoscope to auscultate the heartbeat. The normal HR of the patient depends on patient's age and size. Puppies and kittens have the most rapid HR, from 160 to 220 beats per minute. An adult patient has a normal HR of 60 to 140 beats per minute. Usually, the larger the patient, the slower the HR. Cats and toy breed dogs can be as high as 180 beats per minute. The stethoscope is an instrument used to listen for sounds within the body. There are several types of stethoscope that are made for a specific type of patient or designed to enhance certain functions. Parts of a stethoscope: ear tips. Tube. The tube transmits sounds from the body. Stem. This connects the tube and chest piece. Chest piece, also known as the head, where the diaphragm and the bell are located. Diaphragm helps amplify sound, usually used to listen to low-frequency body sound, like lung sounds. While the bell is used for high-frequency sounds, like fetal heartbeat. How to properly wear a stethoscope. Before putting the ear tips into your ears, twist it until they point slightly forward or towards your nose. This position will follow the anatomical structure of your ear canal. Where to place your stethoscope when checking heart rate. The anatomical position of the heart is at 3 to 6 intercostal space, or the space between the ribs. You can use this as your guide on where to place the stethoscope for auscultation. You may also feel out the patient's thoracic area, where you detect beat activity. Place your patient on lateral position. Move the humerus parallel to the spine and radial ulna perpendicular to the spine. Locate where the elbow is pointing. That will be your auscultation site. How to check HR. To get the beats per minute, count the heartbeat for 15 seconds and multiply by 4. Do not be confused between heart sound and lung sound. Heartbeat sounds like. Try to relax the patient while taking HR. Stress may affect the heart rate. Pulse rate. To check the patient's pulse rate, put your fingers on the inner thigh of the patient. You can make an imaginary line dividing the hind leg vertically to estimate the mid-thigh. You should feel the femoral artery pulsing near the surface. If you are having difficulty assessing if what you are hearing is the heart, you may correlate the sound with the pulse rate by feeling for the pulse while listening for the heart sound. You should feel the femoral artery pulsing near the surface. It's easiest to find if your patient is standing or on lateral recumbent position. Count the number of beats you feel during a 15-second period and multiply by 4 to get the beats per minute. Cat patients may purr during auscultation, so you must be able to distinguish heartbeat from cat purring. The more often you use the stethoscope on more patients, the more refined your auscultation skill will be. Respiratory rate, or RR. Respiratory rate is the number of breaths a patient takes per minute. It is important to measure the RR when the patient is at rest. Stress, anxiety, excitement, and activity may affect the RR of the patient. So as much as possible, try to wait until the patient has calmed down and settled before taking the RR. To take an accurate RR measurement, observe the rise and fall of the thoracic area of the patient. One complete breath comprises of one inhalation, which is when the thoracic area rises, followed by one exhalation, when the thoracic area falls. To measure the RR, count the number of breaths for 15 seconds, then multiply by 4 to get the breaths per minute. Normal range would be around 16 to 40 breaths per minute. With patients who have longer hair or coat, it may be just a little more difficult to observe purely by sight. So what you can do is put your hand on the thoracic area to feel the rise and fall of the chest.